from feeding, engaging in an occupation that is feeding.
Yeah.
So that's where the occupational therapy comes in.
Okay.
The occupational therapist accesses your oral region and looks at how is the plate, how are you able to, how are you able to facilitate the muscle strength, the muscle power to enable you suck or to eat or chew and swallow food. Yes.
Okay. You also mentioned that occupational therapy also deals with the brain and
Yes.
you know, the mind and all that.
Yes.
So can it help with mental conditions like that are common, like, you know, something as simple as, or let me not use the word simple, something as common as anxiety or depression? Does occupational therapy play a role in this?
Good. This will take me back to the history of occupational therapy, where we began. Occupational therapy began in the 1700s, where occupational therapists were like human rights advocates. And during that era, the mental illness or mental psychiatric conditions were really stigmatized and they were really isolated. So occupational therapists by then, they came up with engaging these patients in meaningful activities, and the result, the outcome measure was these patients, they felt, you know, meaning in engaging in life. They came back to reality. And in the 1800s, we have our father, the occupational therapy, the founder of occupational therapies. In fact, he was a psychiatrist.
Okay.
And William Rush Danton, he's the father of occupational therapy, he believed that people or patients are supposed to be involved in occupations. Occupations are as basic as food and drinks. So we need to engage our patients in meaningful occupations so that they are able to have well-being in their mind, they are able to have physical well-being, they are able to have social well-being, and they're able to feel, you know, loved and engaged in a community. So occupational therapy, from the onset, we came from the mental health side of the field. So basically, we are involved in the mental health. When you go to Kenyatta National Hospital, we have a very well-equipped mental health facility in the KPCCC, where you will find out that occupational therapists, we have occupational-based therapeutic activities. For example, we have netball. Remember, occupational therapists, we are looking at the 4 domains. We are looking at the social, the medical, we are looking at the physical. So we have activities like volleyball playing, football playing, we have indoors activities. Remember, these occupational-based activities are used to bring this patient back to reality. If you had anxiety or if you are depressed. Remember, one of the clinical features of depression is an individual isolates himself. Either they're all indoors, they're only watching movies, TikToks, they're doing TikToks, they're doing videos, and they do not want to engage outside. So when we get such a patient in a clinical setup, the one role of an occupational therapist is to make an individualized treatment care or treatment plan to make sure, yes, we have the nurses, the doctors who are giving up to the pharmacological intervention, the medications, but the occupational therapist is looking at the non-pharmacological intervention. What are these practical activities that the patient can be engaged in so that at least they come back to reality? If you are depressed, you are detached from reality. But if you start engaging in therapeutic activities, football, you know, things that you love, playing games, you'll come back and you'll start engaging in meaningful occupations. And that's why all psychiatric conditions, it doesn't matter if you have borderline personality, if you have substance use disorder, you require an occupational therapist so that you'll be able to engage in your various occupations.
Okay. Do you have enough, just out of curiosity, do you have enough occupational therapists in the country?
Well, currently, occupational therapy, number one, this training began in the 1915s. So occupational therapy has been there throughout. We have institutions that are offering occupational therapy training, like the Kenya Medical Training College. We have collaborated as Kenyatta National Hospital has collaborated with the Kenya Medical Training College. We have the JQAT. We have the Presbyterian University that are training our occupational therapists both in the diploma level and in the degree level. So we collaborate with these training institutions. As Kenyatta National Hospital, we train them. So as Mickey Baron, I am a clinical trainer, instructor. I train occupational therapists in the country so that they are more effective and competent. On matters, if we have enough occupational therapists in the country, we have occupational therapists. The matter is, I talked about occupational therapy. We've done advocacy, but the visibility is not there. And right now, disability, impairment, special needs is really coming to arise. And one way that the government, either the Ministry of Education or the Ministry of Health, can collaborate is to employ occupational therapists so that they are able to work in a clinical setup to sort these occupational dysfunctions that our clients have, or to have occupational therapists working in a school setup to enhance, participation in school activities. So the issue is now the absorption of occupational therapists. We need occupational therapists to be absorbed, and the universal health coverage is giving us that leeway. But it is high time now the Ministry of Health to advocate for more occupational therapists to aid on the special needs, the disability population. Yes.
Okay, I hear you on that. Now, maybe what role does the family or the caregiver play in all of this, in the therapy process of a patient?
Of a patient. Thank you. Occupational therapists, we use a certain approach called community-based approach. So community-based approach is a community-centric approach where we use a scientific perspective as occupational therapists, but also we advocate for empowerment and capacity building of caregivers and parents or persons living with disability. So how do we collaborate with this cohort of people? Number one, we do a lot of partnership as occupational therapists. We are partnering with support groups for parents with children with special needs. We have WhatsApp groups that are there, Facebook social media groups that are there. Occupational therapists are there just to guide them, to help them psychologically, to give them the right pathway of intervention. Yes. So how do we involve our patients? When you come for treatment at Kenyatta National Hospital, that is occupational therapy, number one, we look at the occupational therapy process. The occupational therapy process, these are just the stages that we follow during our intervention till the discharge. So when you are referred to us, well, the beauty of occupational therapy, you can just walk in. You don't need any referral from a doctor or any specialist.
Take us through that process.
Yes, so the occupational therapy is, you walk in. At Kenyatta National Hospital, we are stationed at the tower block, the old hospital tower block. So when you just enter, if you see that there is somebody who is unable to perform their self-care, dressing, toileting, grooming, there's somebody who is unable to go to work, perform, be productive enough. There is that person who has issue with the leisure. They cannot no longer participate in occupations that they love doing. We have children who cannot play. We have people who have sleep hygiene issues. We have people who have educational issues. So when you come, when you see that somebody has a deficit in all these components, you need to come to an occupational therapist. Just walk in. The second process that we will do screening. Screening, we're looking at the eligibility criteria. How eligible are you for our services? Is it something that we can just educate you and give you home programs to give out carryover skills? So we empower parents. You can go and do this at home. If you see it does not work, you can now come back. You come back, we now start the assessment process. When we are looking at the assessment process, we are looking at the standardized assessments. Standardized assessments, these are approved, tested tools that we use. As Kenyatta National Hospital Occupational Therapy Department, we have formulated our assessment tools that aid us in finding out the pertinent needs of our patients. We have the non-standardized assessment tools. Non-standardized assessment tool, you'll find an occupational therapist maybe working in the periphery, maybe a place like Isibania, there is no enough resources. The occupational therapist will use a non-standardized assessment tool, where now we'll use interviews and observations, asking you questions just to find out what are the areas that are a mess. So when you are doing our assessment, occupational therapists are looking at the various domains. Domains, these are just rules and frameworks that guides an individual's work. So we look at the areas of occupation that I've talked about. We look at the client factor. We look at the belief of a client, the values of a client. We look at the physiological processes, the body function. We look at the anatomical structures, the anatomic structure. We also look at the performance skills. When we're talking about the performance skills, we are looking at the perceptual skills. Perceptual skills, when we were in high school or primary, we were taught on the 5 senses, smell, touch. So as occupational therapists, the books says that human beings process information through all these senses. For you, you know 5, as we know 8. So we are looking at all these senses. We're looking at how do you process information. When it gets to your brain, how do you modulate this information, and how do you give out a meaningful output. So if you have an